Good morning, everyone. Thank you, Mr. Chairman. Many in this committee are familiar with my son Cole and his story. For those unfamiliar, Cole was born with Down syndrome, and just yesterday we celebrated his 17th birthday. Over the past 17 years, I've had the privilege of meeting with countless families with kids just like Cole, and they all want the same thing: for their kids to have every chance in this world to succeed and live up to their God-given potential. I've dedicated much of my career here in Congress to being an advocate for people with disabilities. We're all a product of our experiences, and that's why I'm grateful for today's hearing, where we will discuss solutions to support access to long-term care for people with disabilities. The Medicaid program was designed as an important safety net for those who truly need assistance and otherwise might not get the vital care that they deserve. Unfortunately, Medicaid doesn't always live up to this mission. States have wait lists for home and community-based services, key long-term care services to empower people with disabilities to live independently in their communities, allowing them to reach their full potential. I've met with too many people over the years who have struggled to get off these wait lists or who have been afraid to pursue jobs out of state and risk being moved to the back of a new state's wait list. So I'm pleased that we are discussing potential solutions to start making sure Medicaid is best serving those who need it most. For example, my bipartisan legislation with Ranking Member Pallone will increase flexibility for states to offer more care by reducing these wait lists and making sure each state is tracking and reporting wait list statistics uniformly. We'll also discuss bipartisan legislation from Representatives Kiggins and Capter that would ensure coverage of home and community-based services for Medicaid-eligible dependents of active-duty military families. As co-chair of the Military Families Caucus, I'm proud to support this legislation, which would mean individuals won't lose coverage when their families move for a new assignment. There's over a dozen other important pieces of legislation that will be discussed today. We're working closely with the ranking member and his team on these bills, the majority of which are bipartisan. And I recognize that not all of them are perfect in their current form. For example, I have concerns with H.R. 8115 and how it would upend the shared state-federal partnership of the Medicaid program. It's important, though, that we discuss and debate the merits of each bill today through regular order and continue to work in a bipartisan manner to find solutions that we can agree on. And today we get the chance to do that. Unfortunately, while we continue to develop bipartisan legislative solutions, the Biden administration is making it more difficult in some instances for people with disabilities to access care. By setting unattainable staffing requirements, I fear that the minimum staffing rule will force nursing homes to close or reduce the number of seniors served. And the Medicaid access rule's so-called 80-20 policy will lead to home care agencies reducing the amount of care that they can provide. Lastly, the recently finalized Medicaid eligibility and enrollment rule is estimated by CMS's own actuary to increase federal spending by tens of billions of dollars over the next 5 years, all without Congress taking a single vote on any of the policies and in the face of widespread opposition from disability advocates and states. In contrast, today, we will begin reasserting our role, Congress's Article I authority, by taking back control of the policymaking process. We'll consider legislation from Mr. Pence and Ms. Kamik that repeal these rules and hopefully avoid the negative consequences that I've already mentioned. This hearing is a great example of Energy and Commerce plowing the hard ground necessary to legislate with proposals to make sure that the Medicaid program is working as intended. And as I mentioned, many of these have bipartisan support. I look forward to today's hearing and continuing to work together to advance these solutions so important to the people that we serve. I yield back.
The chair yields back, and I now recognize the ranking member of the full committee, Mr. Pallone, for 5 minutes.